Hey guys, Don here. Welcome to the $1 Million Minute. I'm going to go over kind of the things that help me get to the $1 Million mark and beyond. Top of mind these days is I'm going to be going to a Shockwave conference coming up here on Saturday, and it's going to be in Boston. So if you've never been to one of these, they're good events. This is time number 3. And kind of the reason I keep going back is because each time I get more ideas, I think I get more comfortable with the technology, and I tend to do a lot. And a lot of my profit in getting to the $1 Million mark comes from not just the Shockwave, but also the orthotics and learning how to do the ultrasound better and things like that. So it might be something you guys want to consider to do. Okay. So this was a good day. I think it's one of my only days I've actually done 4 orthotics in a day. I know my partner tends to do that pretty frequently. I'm still kind of working on it. And I'm going to go first of all through my MVP. So this MVP patient was a patient that came in, this was a 67-year-old female. She had kind of a cavus foot. She's kind of broke her 5th met in the past. She has equinus as well, and she is in some pain. And I got x-rays on her. For the equinus, I did my Pelto special bilateral, which is bilateral night splints, foam rolling, and morning stretch. For the cavus foot, I did orthotics, and she is going to be coming back when the orthotics come in. So that's kind of the MVP of the day because of the bilateral night splints and things like that. There was also, I guess, my second MVP was a patient that came in. She's a 53-year-old female. She had x-rays, ultrasound, posterior tibial tendinitis, kind of a collapsing foot with tendinitis, and so we're going to do 3 sessions of Shockwave, put her in a cam boot to kind of rest things down, and then on the first Shockwave we're going to scan her for orthotics as well. So that would be kind of the second MVP. Okay, so a lot of the kind of the repetitive, if you've been listening to these before, I don't want to belabor the tune here, but my Lamisil booster, which is my second Lamisil visit, it's a level 4 visit because I do medication management. And then I'm not going to see that patient back. I'm going to tell you which I'm not going to see back, because I think part of the reason way to get to the million as well is who you don't see back or who you see back less. So trying to reduce the low level visits and increase the higher level visits. There was another patient that came in for lesion destruction, just had a wart on the medial hallux. Thought it was a wart, but I think it might have been like a scab or something else like that. I'm not going to see that patient back. Another patient that came in for a follow-up for orthotics, 6 weeks. So my orthotic follow-up is 6 weeks after. She's a 72-year-old female. She's doing much better with her orthotics. She doesn't like it that they squeak, so I told her to put talc in them. That's what I do, or a dryer sheet underneath them. Maybe I should have, instead of doing, I think she did like a leather top cover or a kind of a fake leather, maybe doing like the Spenco type of top cover might have been better for her. Another patient that came in, this was a patient, I had previously done an arthroplasty, a derotational arthroplasty on the 5th toe because of a soft corn between the 4th and 5th toe. I did it on one side, and his scar, every time he bent it, where kind of there was no bone, there's scar in there, it's kind of hurting him. So what I did, and I don't do this a lot, but I did twice today, but I don't do it usually a lot, is I use my Cutera for laser of that area, and to kind of heat up the tissue to kind of relay down the scar tissue in kind of a more regular fashion. So I heated it up until tolerance, and I also got x-rays on this guy because I'm going to be doing surgery on the other side, and we kind of discussed that surgery. And I'm going to do 4 of these. I tend to do 4 of these scar laser treatments, and they tend to do Mederma and either a tape or a scar guard on top of the scar to help moisturize it. And he'll be back for those other 3. So each of those are going to be lesion destruction codes. Those one kind of like the same code that you would use for like lasering a wart or something like that. Next patient was a patient that came in for a flat foot. New patient got orthotics. The follow-up wasn't scheduled because they'll come in 6 weeks after the orthotics come in. Next patient was a patient that had an EPAT follow-up. This gentleman, 75-year-old man, he's doing much better. I did an ultrasound, so I do an ultrasound before they start Shockwave, and then I showed him the tissue afterwards. And this tissue was still a little bit thick, but there wasn't as much of an effusion in the ultrasound. But I did discuss with him that to take the pull off of the fascia, the best way is using an orthotic, a high contouring orthotic. And so we did orthotic number 2 for the day, and he'll come back to pick those up. Next patient was a follow-up plantar fasciitis patient. and she as well is doing better. She got orthotics a couple of days or like a week ago, and I did an ultrasound on her, and it's getting better, and I'm going to see her 6 weeks for the orthotic follow-up. Another patient that came in, new patient, that's the one I talked about before. That was my MVP with the equinus and the cavus foot. Another patient was EPAT number 3 for metatarsalgia on the second metatarsal, feeling much better, doing a 2-month follow-up for that patient. So once again, last Shockwave, so EPAT number 3 for me, or whatever the last one, it might be 6, might be 4, but then I always do an office visit the last one, and I give them out a little piece of paper, which is called my Shockwave last visit. If you want that paper I give them, it just goes over kind of what we're going to do next, kind of has a plan, and it allows me to bill an office visit on the last Shockwave instead of just doing the Shockwave fee. The other patient was this would be a 2-month follow-up after Shockwave, and she's much better, so I don't need to see her back. Another patient that came in, new patient, had metatarsalgia and pain, so I did x-rays, and I did an orthotic. That was the third orthotic of the day. Another Lamisil booster, so patient, and then they're not going to come back. And there was another patient that was an orthotic follow-up, feeling much better, doesn't need to follow up with me anymore. They got clean sweep because they had a little bit of odor. This is a patient that can't put on a sock, so we got something called clean sweep that we have in the office. Another patient that was a matrix follow-up. I did a matrix, and they're going to follow up in 3 weeks. So this was kind of a new patient, had a previous matrix or ingrown toenail done somewhere else, been bothering her. So matrices, I used to do a 2-week and a 4-week follow-up. Now I just do a 3-week to avoid one of those visits. I know some people don't do any follow-ups with matrices, but I still do one. Another patient came in for, I think it was a wart, and this was another doctor that was treating this patient, and I did a laser on this patient. I did laser and cantharidin. So this patient was seen every month, and they're getting smaller. So what I do is I have a Cutera laser, so I did the laser first, and then I did the cantharidin after that. I kind of hit it doubly. And then the patient will follow up in a month. Another patient came in, a follow-up after a hospital stay. They were admitted for cellulitis. I think I may have talked about this one before. He's doing much, much better. He got IV antibiotics, and his ulcer is almost healed. I did not debride down the ulcer. Kind of looks like snakeskin now because the swelling is coming down, and I'm going to see him in a week because he's still on oral antibiotics. Another patient came in, 65-year-old female, for orthotic follow-up, doing well. And usually with these orthotics, if they're doing well, I'll see them either in 1 or 2 years. At this time, I may change that just because they're not the most exciting visits, but that's what I do. The other patient came in was an EPAT number 3 for the heel. I did the EPAT last visit, which is a level 3 office visit. Next one was that tendinitis one that I was telling you about. Another patient that came in for a scar. This was a patient that had that brachy met by someone else, and it was kind of plantar flexed, and I'm trying to loosen up the tissue. Today I did the laser scar, and I also did Shockwave to help with that. And then there's I don't normally do Shockwave, right, to help it, but the other option is I'd use I open up the joint and do a McGlamry elevator to help bring up that toe. I'm trying to avoid another surgery for this patient. Another patient this is kind of a challenging one. This patient had a previous 5th met fracture seen by a couple of other doctors, wasn't getting better, had like 2 CTs, 1 MRI, and I reviewed the external notes. So I thought is if you review the external notes, that kind of brings you up to a level 4, okay, because you're reviewing external notes that they didn't know about. So I found that in my EMR I can see those things. And this patient, I did order another MRI just to see, because on the X-ray, to me, it looked like there was kind of an avulsion fragment from the peroneals on that 5th net base, and so I just want to see if that truly is the issue, because her pain seems a little out of proportion. They were saying that she had like an RSD, which is always a challenging thing for our patients, and they were considering like back injections. So those are challenging ones. I feel like they just kind of get punted down the road, and I want to kind of get an MRI to see if there's anything else that was kind of being missed there. Then there's another patient that had a cyst at the, I think it was the 2nd digit, the DIPJ, kind of a cyst that's come back multiple times. It's been popped. She's popped it. I popped it. And I talked to her about possibly fusing the joint or popping it, and she opted to pop it and use Coban for 2 weeks. And then the last one was a a Lamisil booster. So those are the things from the day. I'll let you guys know. We have a couple more days left in the week before we go to the Shockwave conference, but I will certainly share everything that I learn each day, kind of do a little blurb about that. Once again, hope you guys find this beneficial. If you want to understand any of the things that I talk about that aren't clear, just let me know. Shoot me an email down at podiatrypracticemastery.com. Also, if you want to do, I do have some time there for a short little coaching call, like either in the morning or at night, if you want to chat about any of these things to make you help get to the $1 million mark and beyond. Okay, thanks.